It's going to take a few minutes.
Hi, everyone. This is Connie Zack. I am one of the owners of Sunlighten, and I am thrilled to do this series again. We have a very special guest with us today that we have worked with for, as long as I can remember, almost since when we first started our company, Sunlighten. And so this is May is Lyme Disease Awareness Month, and so our special guest is an expert on Lyme disease, Ms. Debbie Floyd, who has been the executive director. She was the former executive director of the Clean Heart Academy, which is where we work extensively with her. And she did that for at least probably 12 years or more. She is also had her own personal experience with Lyme disease, as well as going through the journey with her daughter. And I'm really anxious to hear all her stories and how she can share her wisdom with all of you. So please go ahead, and as she speaks, go ahead and ask questions in the chat, and we will answer them as much as possible throughout the series. So Debbie, why don't you first share a little bit about your story and how everything happened and your experience. Sure. Thank you so much for being here.
Glad to do that. And thank you, Connie, for hosting this. And to all of you at Sunlighten, I do have to say, without your sponsorship for the programs that we have run over the past decade, we could not have put the programs out there. We've trained many practitioners and health coaches, and we really need the support of all these beautiful exhibitors that we really believe in and use. So again, I want to thank you, and a big shout out to all of those out there, those that took the invitation. I know I sent it kind of late to many of you, but to our friends and practitioners in the world of Lyme disease and chronic illness, and our certified practitioners at the Academy, thanks for being here. You know, I've always been the one behind the curtain, behind the scene, and no one knows my story because it really wasn't that important to share. But to everything there is a season. So I'm glad to do that. Here we go. I know kind of you're interested in sharing, besides the detox strategies, struggles and interesting information about Lyme disease that maybe the average person doesn't know. And I'm kind of going to assume that some people know a lot about it now because it's been in the press for a while. There's some good information out there, but there's still a lot of confusion about the diagnosis, etc. I want people to know that I've been in your shoes. That's why I've been able to help many people along with the detox, which I find is key to moving forward with Lyme disease and other conditions. But the struggles that I've had are like the struggles people share. Number one, there's emotional struggles that come with this. It's the fear of the unknown. You've got a diagnosis. What the heck is this? I was told I have Lyme disease. What do I do? People call it fear, and that's accepted it. Fear is the worst thing, as we know. The physical struggles, there are no two patients alike. And I'll go through later what we find are the typical symptoms that the average person feels, but no two people have it the same. So that's a struggle. A struggle sharing that with your family because on the outside you look pretty darn normal. They say, you're not really sick. Is it all in your mind? Doctors are telling you this. Is it all in your mind? They still don't totally understand it. Relationship struggles financially, to tell your spouse you have Lyme, the spouse is healthy. You have to do all these crazy, crazy protocols that cost a lot of money. Equipment you need, this you need, that you need. You're willing to try anything, but especially for your children. And if it's not you, you'll go to extremes for your child, which is what I did. I've walked through Lyme, and I've been in everyone's shoes that's going through it, but I want people to know there is hope. You can walk through it. Things can get better. Things may not totally change, but the most important things in life can change, and I'll get to that. My journey. I probably had Lyme for a long time and didn't know it. My symptoms myself were more mild things that ended up being an autoimmune condition that I suffered with for many years, but it was always mild. I still have an autoimmune issue going on. So being that I'm better with the Lyme issue, some things still remain, and you learn how to live with things and to keep things under control. But I didn't know much about Lyme until I heard about it when I was a young single person in New York City. I heard it happened in Lyme, Connecticut. Everyone knows that's where Lyme came from, the word Lyme, Lyme, from Lyme, Connecticut. But we know it's been around way before that. It's been around at least since the Ice Age, because we found the DNA, in the Iceman that was found, about 10 years back or so, in the Alps. And they found that the Borrelia spirochete's been around forever. So we know it didn't develop in Lyme, but it kind of became more well-known, more pronounced, and more people were getting it then. I go back to when, after I was young married, I had two children right in a row, and my husband was transferred to California, and an opportunity of leaving my career, which I didn't think I ever would. I was in my early 30s. Moved from Manhattan to California, and our first week there, we started touring around in the beautiful hills of California. And many people have been there, have noticed the beautiful grasses and the wildflowers growing. So I took my little 3-year-old daughter. I said, honey, get a picture of us. Snap a picture. I want to go up in the grasses and pick wildflowers with Liz. We did. And we had a great day, a picnic. On the way back in the car, I was just rubbing her back and I felt a lump. It was a tick, an embedded tick, big bloody tick. I have never seen a tick before. Pulled it out with my fingernails, threw it out the car. And I was thinking, ticks give Lyme disease. I said, no, but not in California. That's only on the East Coast. That was years ago. So of course, she started with symptoms pretty quickly. Didn't think it was Lyme, but I did take her to a pediatrician. She was wheezing at night. She was sweating, wheezing. My husband had to carry her outside at night. What the heck was going on? No one found anything. So we were there until she was in 4th grade, and she was having cyclical symptoms of sweat, wheezing, allergy symptoms. They thought, it's probably acquired allergies, and they gave her allergy treatment, but nothing would heal it. I think it'd get better. And as we know with Lyme, things happen in cycles, so we thought she was better, and then things would happen again. That ended up being her new norm, and my new norm, just kind of taking care of symptoms with nebulizers. Fast forward, we moved back to New Jersey, transferred back, and our life got a little busier. In the New York metro area, it's not as laid back and chilled as it is on the West Coast. And we got thrown into a world of busy schedules. Both kids were very athletic in sports. Liz with Lyme, she was actually very competitive. It's a part of the story because she is actually kind of a physical specimen of a competitive athlete, has great eye-hand coordination with any sport. And she just would do really well in all her sports. And then 1 week out of the month, she couldn't walk, couldn't move, couldn't talk. So I started watching that. And then things kind of escalated with her too. In school was harder. She was having trouble sometimes remembering things. She would do great on a test, the next day not. Typical Lyme symptoms. And one of my neighbors said to me, a new neighbor I had, said, Debbie, it sounds like Lyme disease. I think you should get her tested. I said, but she's been tested for that, and it never came up. She goes, Debbie, it just sounds like it to me. She goes, I had it. I almost died of a heart attack, a young woman. Wow. And so she sent me to her specialists, which were infectious disease doctors, but they were cardiologists. They found nothing. We did the basic, Western blot test, and I'll get into the test later. We did everything we could. But you know what? It just put me on a real mission. I had a mission now to finally get to the bottom of this, because it was affecting her life at school, and they think it was affecting her brain, whatever. So I did go on a journey, and again, dating myself, the internet was just becoming popular with Lyme chat rooms. Now they're everywhere, but there was only one called LymeNet at the time. Someone told me about it. I went on, and it was very active, and it was controversial. And I was very much drawn to natural protocols on it, listening and learning from people. And I became one of those obsessed people that call me, trying to find their diagnosis, and the ones that the doctors hate. I ended up not being one of the doctors hated, because I would go to them in a very conscious way and had some nice questions. And I was actually teaching many of the doctors I went to about Lyme disease at the time. It was so new. So I ended up learning about a doctor from some woman. She called herself Gigi online. She became my friend, little Gigi. And she was sort of guiding me with things that I thought were really good. People didn't like her on the site because they thought she was controversial, tried to kick her off. She's talking about natural protocols, and a German doctor, a German Lyme doctor that was helping her, And I wouldn't even mention a name. You probably all know who I'm thinking of. Never heard of him, but she was guiding me along something called the 5 levels of healing, which I've come to know and have been teaching for many years now. I was guided step by step, inch by inch, one thing at a time, and never drawn to seeing that doctor. But let me tell you, it was quite an amazing thing. So step by step, I found a Lyme literate doctor. We started on antibiotic protocols at first. Then we got better to some degree because we each had co-infections. We had a test from Igenex that came out positive. I took the test because she did, found out that mothers can pass it. So I said, I better get myself tested. Did that. Got the rest of my family tested with no symptoms. Igenex test, everyone comes out positive. Okay. So I've learned you don't treat anyone who doesn't have symptoms of something, because in these very deep tests, we've all come to believe now in the group that I hang with, the doctors, that everyone has Lyme somewhere hidden deep. So, but the people that have active Lyme, it's either a new infection or it's a persistent one with other deep things that need to be cleared. So I'll try to go quickly through my journey into the more to the Lyme things. So as time went by, I was learning more of these natural things, and the Lyme doctor that was actually helping us, the Lyme literate doctor, with antibiotics and some natural things, with a diet, gluten-free diet, etc. Everything was working well, except my daughter had to go to an Olympic level swim meet to qualify for Olympic trials. She was swimming at 12 years old against, at meets with like Michael Phelps, Katie Hobb. And she was definitely a very, very high caliber swimmer. I'm not just talking athlete, someone who I knew one day could swim Olympic time, the next day can't walk. So I was hiding. I wanted to get her off of antibiotics, to go in the sun. And my doctor said, under no circumstances, she will revert, you will revert. And she goes, I think she should go in a port. I said, no one can swim with a port. And she had a hard talk with me, Mama, what's more important, your daughter's health or swimming? Okay. And I had said, I'll have to think about that. I have to think about that, I have to think, and I didn't tell her. But, so I said, you know what? I talked to my little buddy Gigi online and told her my situation. She goes, well, this is what the famous Dr. K, the German doctor, would say to do, how to detox someone. And I did it. I learned how many days to get off of doxy before I can be in the sun, when we can go, and then when to think about thinking a relapse could happen, what to possibly do. Well, let's just say this. I took her, we went, and then we went to Hawaii for 4 days during her spring break, because she swam during her high school spring break. And we never had a relapse. Okay.
Wow.
In the meantime, the other thing, I won't go into it deeply now, but if you ever want to learn more, I'm going to put up my notes online. You can read what really happened. The last part of the 5 levels of healing is spiritual. And neither of us have had Lyme since. We actually had a healing with prayer, step by step, inch by inch. So that's kind of what happened along the way. And there is hope at the end of all of this, and it's really not the end. Anyone can get reinfected, so we're on the lookout for that. And a part of that, the journey, is during that time period, detox was really, really important. I did find a doctor who did muscle testing, because the Gigi woman told me I should get someone who does muscle testing to guide me with detox. Now that we're done with the antibiotic regime, it's time to kind of move forward and learn about your body, learn how to clear the matrix, how to keep your immune system functioning as good as it can, because your body's different than others. So I bought a Sunlighten sauna. That was my beginning with Sunlighten. Way before I was involved in the world of health, I was living it. And I heard about far infrared, and I made the big fight, the big investment, did it. And it was such a beautiful oasis to have in my home for my daughter after swim practices, and she had 2 or 3 practices a day, and weights. And so it was swim, eat, sleep, swim, repeat. She'd get in the sauna, and then I would get in there, and it was really good. Both of us have people may know the MTHFR issue, where you don't detox well. There's a whole, you can get tested for that. And a lot of the autism group has it. They're born with the inability to detox. Okay. And they don't sweat. It takes them forever in a sauna. They could be in there for hours and they may not sweat. That's a tiny subset. But there are some people with Lyme and autoimmune issues that also have that. You can get around that. And I learned other things you can do to get your body able to sweat, so you get the best benefit out of the sauna.
So on that note, because that comes up a lot.
Does it? Okay.
Yeah. So maybe if you can, that's a major question.
It is a major question.
All of the time is about sweating, and because a lot of people don't really truly understand how far infrared works and how it's a lower temperature and how it's focusing on getting into the body. And so they're thinking sauna, they're thinking excessive heat, they're expecting to get in and just like pour out into sweat. And if they're sick, they're concerned that they're not getting a benefit
Right.
because, they're not profusely sweating. So if you can touch on that, especially with your daughter specifically, that would be awesome.
I will, because I mean, even someone who's a very fine-tuned athlete, sometimes they don't really sweat a lot. They could be a runner, they could be doing distance swimming, whatever, and you wouldn't notice. If they have the issue of this MTHFR gene, it's kind of a weird thing. That's one thing. But less is more. I've learned that in this world of natural medicine, we use a lot of lights, infrared lights for various things in healing. A lot of photons. Less is more with light, and the idea is less light goes in deeper. Okay, and you probably know more than that. I'm not the scientist, but it goes in deep, and it does a lot without having to perspire a whole lot. You don't need to. And the famous German doctor has said many times, I listened to everything, that he thinks you only need 15 minutes in a far infrared sauna. You shouldn't go for the same sweat you would get like in a steam sauna or one of those old Swedish saunas you get in, and that's a cozy feeling too, just to let it out and let it all sweat out. You don't need to do that.
Right.
But it is so interesting for my daughter and I. We would get it. We do the 15 minutes or so. I'd let it heat up before we got in. When we go in there, and I would always make her sit on a towel because it's my sauna. No one gets like their own toxins in my sauna. Let me tell you, I'm like, I've got the towel down there. Then you come in your towel, and then you bring a little chamois or you bring a little hand towel in with you. So as you're going, the idea is to kind of just move the lymph a little. This is what we do. Okay, I'm not going to speak for you. You can do your thing later on this, but we kind of move the lymph, around a little with a little towel, and you start to feel the warmth on the body. It's relaxing, and then after your 15 minutes, if you're starting to get a tiny bit of heat, you just kind of rub it off because it is very toxic. You don't want to reabsorb it. My thought is that if it dries on my skin, then it's kind of there again. Whatever you put on your skin gets reabsorbed a little bit. So I kind of just like to wipe it off. And the idea too with it is to hydrate before and after. A lot of people that have problems, if they know that, the people I'm talking about, if you know it's you know that you've worked out, you've done aerobics and running, you still haven't sweat, and the other partner has. Those people have issues with toxins that have built up in those cells. And it could be related to things like my problem is heavy metals, which is why I have an autoimmune and a thyroid issue. I had mercury in my mouth with amalgams my age years ago. So that is why I have my issue. So there's different reasons people have it. But what you can learn to do, and we have protocols I won't go into now, they're individualized, but how to get your cells to methylate, to get your cells to open up and go, relax, so that when you get in the sauna, it can really work and do its thing. But also beforehand, we've added some water, and you can kind of do it, make your own little mix. I have a Brita, one of those Brita filters, and I make a big pitcher of that, put in a tiny bit of electrolytes or just really beautiful sea salt, which has minerals in it. That's kind of getting your electrolytes and minerals. When you take that in and then you add the sauna and some other things, we also use a foot bath for the people that don't remember that. Yeah, and so, it really helps the people with the MTHFR, the autism group, for the cells to open up. Then what that does, it shuttles in the beautiful minerals into the cell so that things leave even quicker. And we've measured it. I've been a part of groups where we've measured urine. An average person doesn't need to do that. Just know anything that's coming out of your skin, it's good to get it out. Anything that's coming out of any part of your orifice, your skin, and we check the urine, even after the foot bath that we use the ion cleanse by AMD because it has the specific frequencies for that subset of patients, the sick patients. It actually, we can test the urine before and after, on it. So I'm not saying we need to be doing all of that, but I do it. I'm on a specific protocol for mercury often, and I can actually find mercury in the urine later. And I'm sure it's coming out in the skin, in the neck area, wherever the jaw area was. So that's just a little tip to give you with that. But so, detox has been essential.
So on that note, and this is probably my last question on this specific, but it's something that comes up often is, would you say, I think I heard you say this, but I don't want to use your one words. Would you say that if you are one of those individuals that really struggles to sweat, though, like then it is even more important than somebody who easily sweats to detox, because it could be the reason that you struggle with sweating. There could be an underlying condition that's blocking you from being able to have your cells open up. And is that a fair statement?
It's a fair statement, and it is individual, so we're making, generic statement here, but it is fair statement. A lot of times we don't believe in pushing the body. When I say less is more, if something's not working, then maybe it's not the time. There are subsets, of patients. When I say that, in the patients that the doctors that I have worked with and trained are the sickest of the world. They've already been to like 20 doctors before they've been to this group. So they have very unique things, and maybe there are some cases that probably it's not the right thing to be in a sauna at this time. Okay. But it's a very rare subset of patients that they need to do some other things to prepare for that. So I think people need to judge their own bodies. But if it's something where you just feel like you don't sweat, there's some simple things you can do that are pretty darn cheap to do at home. And a sauna, it's an investment, but I do know it's a valuable thing to have. If you can do it, your whole family can benefit. So I do say that, and I do know that the doctors that have them have fantastic results with patients that use them. A lot of times, like people I think that buy, if they can't get a sauna, they'll buy a certain amount of passes or something to use a sauna at a facility, at a detox facility. So there's options if you can't afford things. The other thing I also recommend is move your body. And if you can move your body during the day, and I like to do the saunas more toward the evening because I also like to shower at some point. It doesn't have to be right away, but at some point later, everyone has their time. But if you can move the body, and if you're so sick, we have other ways we can help people moving the body. We have these EMF mats and this and that. But not everyone needs that. You just walk briskly, get a rebounder, do something. Do something, because you got it in this stage. If you move your body, then you get your body to open up, you hydrate correctly, then get into sauna. There's a cycle that happens. There's an order, and your body will know the order. It just feels right.
Mm-hmm. So when your daughter was doing this, when she was following this new kind of protocol that you worked with her that was successful, how often was she using the Sunlighten sauna? Was it daily or?
No, it wasn't daily. It's hard to know. Probably every few days. She'd slip into it all the time, and I didn't know she was in it because it just felt good. She had a very regimented schedule. So as soon as she got home from swimming, I had food prepared. I would make them smoothies in the car. Their health was good, and better than the average person then, because people weren't into even eating natural and doing things like smoothies and right things. Then she would slip into it, and she just really felt good in it. And she misses it now. She's in San Diego, a yoga instructor, and she doesn't have one. So she misses doing it right now. But when she's home, she's in it all the time. I have to kick her out. Yeah. Well, but we did introduce it to people. She trained at the Olympic Training Center at the time. They didn't have any of that. They have all this stuff now there, so.
Is she still swimming or no?
No, not competitively. She's thinking about getting into masters. I think it's a job. It ends up being a job when you swim that level and you swim in college. She gets scholarship. Both of my kids swam, and she's dating someone that actually, almost like he just missed going to the Olympics. And so when he comes to visit us, we have a place at the shore, and he won't even swim in front of me. He's like yeah. But I think, I can look back sometimes and say, oh, do I regret what we did? It just kind of happened. What I didn't share with you all too, part of my journey during Lyme, right when I was in the middle of that crazy schedule with both of my kids going to 2 separate private schools, practice before and after school, sometimes 3 times, and then a high school club meet and high school. I also was the, I would say, patient advocate for my in-laws with Alzheimer's, 2 of them. One had dementia, one had Alzheimer's, living together. Then we had to move into an assisted living. I was just doing everything throughout the day. And an aunt with cancer, and my sister with autism that ended up with pancreatic cancer. And all of them had kind of passed. They all passed away.
Oh my
right
goodness.
around the same time. You know, when I was able to get them better, they were in trials at Columbia University, and I was driving them to all their visits in between all my other things because I wasn't working, you know, the mom not working. And I learned a lot, and I was able to share with the group that was studying the Alzheimer's at Columbia University the natural protocol I put my mother-in-law on because they had her on a trial for a drug. I don't know if she was actually getting the drug or not. Or it was a placebo. But I saw a change in her. She could actually remember who we are when I just took away her Splenda and her Diet Cokes and all the white food and sugars. And I saw a complete change in her, and so did her caregivers. Now, it didn't stop the Alzheimer's from happening. The same thing with the aunt with cancer. She got better, but didn't want to change her diet. Diet really matters. You know, things that we can do to take the inflammation in our body away. But I had become, I don't know how this happened. I didn't want a job. I didn't need to work, but I had many of these doctors contacting me and saying, you know, hey, you seem to really have it together. There's another caregiver that could use help. Can they call you? Sure, sure, you know. So I did that for a while. And then from that, one of these doctors that was helping me wanted to teach me how to do muscle testing. She had learned it actually from the famous German doctor. He keeps coming up with, you know, so I was helping her occasionally when she had the hard cases from September 11th. I live in New Jersey. From where I live on the hill, we saw it. We saw it come down. I'm that close. And we had a lot of people coming in that were the first responders with all these crazy illnesses. So she would call me up, this beautiful New Jersey practitioner who was certified under the famous German doctor. And I was helping her, so I learned a lot. And then that following year, my daughter everyone was kind of moved away, or they passed away in the family, or didn't need me to care for them anymore. They're in long-term care. And I was an empty nester. She was going off to college. My husband says, hey, you're going to need a job, aren't you, or something? What are you going to do? Because no one, you don't have anything to do all day. I'm like, just send me to a spa for a year. You know, I am exhausted. Well, that day, the famous German doctor called me on the phone.
Oh
Never met
wow.
Never met him. On the car going to Boston. My daughter picks up the phone for me. Mom, it's this guy with a German accent on the phone. Hey, Debbie, you don't know me, but I'm Dr. Klinghardt. And I thought it was a joke. I said, who in the world is this? No, 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 it's no joke, no joke. It's really me. I know you don't know me, but you're supposed to be the director running a teaching academy for me.
Oh wow. What a
I
great
said,
story.
no, wrong person, wrong person. Well, he goes, no, not wrong person. I'm intuitive. You don't know me. It's you. So that started something new. I said no. He flew in to convince me. So I took it year by year, every year. And it was 10 years. And it was it's a beautiful time. So I do give honor and credit to him and all the other people that have taught me. And I feel like I'm very grateful for being a conduit. I feel like I have all this information at my fingertips. And that's what Discovery Health Solutions is now. It's always been that. Discovery Health Solutions was kind of, you know, always running everything for him and others. What we're doing now is giving a beautiful platform for the doctors that I've learned because each has something different to offer. Some know more about detox than any of us. Some know more about methylation or more about Lyme. And we're going to give them platforms like what we're doing now so they can share beautiful things that are for free for the world. And I'm so glad because of you, Connie, and the other wonderful exhibitors that have supported us. We have done this and it's set it up for the future for our
Oh,
children. Thank you.
well, it's wonderful. Of course, it's our
Mm-hmm.
pleasure. And I mean, we were all, all in. That's kind of Sunlighten style. Is when we find, a cause or a thought leader or an organization that we believe in, and this is so important to find, ways to heal people, from Lyme disease. And the famous German doctor that you worked
Dr. Klinghardt. I just didn't want to, put him out there.
with.
All
I mean,
respect and honor.
yes,
Mhm.
I mean, just I always called him like the godfather of Lyme, where he was
Yes.
just so incredibly knowledgeable. And to just think of the magic and absorption of all of that knowledge and wisdom that you have gleaned from that experience. I mean, I'm so thrilled that you're now doing, you know, your own work, and also that you're also sharing your story, because that's really important for others to know that, you weren't just the woman behind the mirror and the woman behind all of us. I mean, this is, you had your own personal experience and your own personal story. And I mean, I'm so in awe of, having 2 children and going off that traditional path and making that decision of, okay, like, is she going to go swim, or is she going to right. Oh man, that's a big decision. And, I feel like I should applaud you, for doing what you did, and to really focus on the natural healing and the detoxification, etc. And as far as going forward,
yes,
can you share maybe some tips for preventative treatments for Lyme? I mean, this is, Lyme Disease Awareness Month, and there's so many things to learn. I mean, there's so many things. I mean, I've been doing this with Sunlighten, and I've been supporting, Dr. K and for you and other organizations for, 15, 16, 17 years. And there's still like, we still learn more, all the time. So we're all about, at Sunlighten, prevention and like living your best life to prepare, for, to live a healthy life. So what would you say to somebody who doesn't have it, but they want to?
Yeah, if you don't have it, then you shouldn't be worried about it, but you should know that if you see a tick on you,
yes,
if and if they come in, you could have a tick just from walking in the woods or walking at the beach. They're on the beach grasses. You think you're walking on a sandy path, and one little thing comes on you. If something's embedded, I would quickly take a picture of it. And I would, and I'm not really a big proponent of antibiotics, but when you need them, you need them. Okay. Dr. Klinger would say that, and all my people would say that too. I don't want to speak, but there are times for natural things, and there are times for what works. And if you've had something embedded, and we're not even going to go with how many seconds or minutes or anything, no one really knows, but it does go pretty quickly through the bloodstream. And I've heard in the lectures right into the central nervous system, etc. Pretty quickly. It's a shape of, the Borrelia, there's different types of them, but they're the shape of a spirochete spiral, like a little screw, and it can zoom right through you. And it doesn't live in the blood. So I wouldn't even rely on blood tests. If you take a picture of it or get a picture of the rash, they call the EM rash, the migrans rash, then typically any Medi-Merge or a quick medical thing will give you a script for a course of either doxycycline, amoxicillin, something, whatever they want to give you, just take it. I don't have any now. I was just thinking about it recently because someone else called me yesterday that wanted to know if they had a tick bite, what to do. And I don't really give medical treatment. I can't. I'm not a medical doctor, but I'm going to give you generalities. It's always good to have an extra little bit of that around when you travel. And, you take it, you just don't want to be in the sun with it for a while. Okay. But it's good to have that. You're walking in the woods. Just think about, okay, I'm just not in fear, but hey, ticks live here. Stuff lives here. I'll wear a baseball cap. I'll wear long pants if I can and tuck them into my hiking boots or into socks. That's an easy fix on it. And people have sent me many sprays over the years to test, and I do like that cedar spray. There's like a cedar oil that you can get. It seems to be really darn effective when you spray it on. My son, when he got out of school, he went in the military. He was a captain in the military, and he learned a lot from me. He says, Mom, I did deer tick checks on everybody, to see in the woods, because they would sleep out actually on the ground. Okay, in the military.
There is on that note, sorry to interrupt you, but this is really, people want to know, like, from the expert, for cedar oil, like, because you said that was really pretty effective. Is there, is it just a generic oil, or is there a particular brand? Like, if somebody was going out, like, I'm positive that people are going to start like getting outside into nature more, like, it's summer is.
You know what? I never look at the brands that we sell. I have a pile of it. I have a beach home, and there's areas where I think there are ticks, and I spray it around. I spray it right on me. I'm supposed to spray it on the skin. They say it could be irritating. I haven't had that happen. Okay. But if I have flip flops on, I'm going somewhere and think I may walk somewhere, I spray it around by the feet. I think it's better to spray, on your sock or on your clothes. I would think it keeps things off. And
is this
so I don't know the name. I think there's one called Pete's, and I don't know if it really is. And I'm not here promoting a product, but I know the name of one of the oils. Yeah. you can just look online. They should be, if they have the pure oil in it, it should be good. And there are other forms of essential oils too that I've tried, but I think I like that the best. And I haven't had an issue with any of that. And there are also some homeopathics people take. I'm not going to get into that too much, but they have to be a certain person to understand how that works. But it kind of makes your body ticks not want to be on your body, supposedly. I haven't had experience using them, but some people make something like homochords or opposites of ticks and things like that on their body. But there's, if you're going to get it, you're going to get it. The big way people get it though is from their animals, dogs and their cats that go outside. They sleep with them, and the cats and dogs come up on the sofa, and you just don't know what's there. So keeping clean in the house, I think people get it more that way than walking through the room.
So we just got a question to follow up on that is, do you always get a rash from a tick?
Yeah. No, you don't. You don't always get a rash. And here's something that I've heard the famous German doctor and a few others say at the iLabs conferences, that when you get the rash, it proves it's not your first infection. Okay.
Oh, wow.
The rash is like, I'm not saying this right, but it's kind of like the antibodies or something. It's basically saying you already have it. It's your body's immune system is responding in some way. You get the rash because you already have it. It's almost like it's saying, here you come again.
Oh, wow.
So that, and what it says to me too along that line, there have been people that don't get rashes, and there's been a few people that I know are doctors with muscle testing have tested, and they don't come up positive even with muscle testing. Our group, we pretty much rely on that. We don't rely on all the blood tests because the muscle testing is kind of a very accurate form of it. But they all look at the blood too. They look at everything when they look at a patient. So if you don't see a rash, it may be maybe there's that strong immune system. We don't know why. Could be many, many reasons. But we think everybody has Lyme. We're not going to say everyone has it, but it's hidden deep. What brings it out are other issues. So keeping the body clean. Back to your question, Connie, how to stay away from it. You get a new tick bite, you take care of it immediately. The antibiotics do work. They'll take care of it if you get it immediately. The new one. They don't take care of persistent infection. That's the difference. Being on long-term antibiotics for some people with IVs, if they have very, very severe symptoms that are life-threatening, antibiotics can keep the person alive. So we're not, our group is not negative to doing that. The idea is use herbals. There are many herbal things you can do. And I can go through a list of some of those and some names that you can look up. You can buy the tinctures. You can make your own little cocktail at home and have that around. But that's not going to heal a Lyme right away if you just get a bite. Do the antibiotic. Then you have to clean up the body from the antibiotic.
Right.
Debris from that. You're killing things. You're killing your beautiful microbiome, your bacteria. And sauna is good for that too.
Right. So as far as I just want to make sure, because on the rash, just to finish that, close the loop, it is possible, like even if you don't have a rash, right, and you just have like a red bump or whatever, it is still possible that you could have Lyme. Is that an accurate statement?
There have been patients come in that have had no rash. They said there was a little tick there. They saw a little something, but they wiped it off. Okay. They didn't see an embedded tick. And they, all of a sudden, within a few days or so, ended with symptoms. Sometimes that happens. People come in with symptoms and they wish they came in earlier. Okay. So those are the two main problems, with Lyme disease. The difficulty in diagnosing it is you either don't diagnose it quickly enough, okay, and you get persistent ones. That's one of the main ones. Or, with Lyme, it's just getting a false negative when you get a test.
Mm-hmm.
Okay, so there's more false negatives than there are false positives. There's really no false positive. But the tests that are covered by medical insurance, it's like a Western blot test, et cetera. You need blood work for that. And as I said, it doesn't live in the blood. So, you get a blood draw. Were they lucky to actually get a spirochete in it as it was moving from your tissue? Because it lives in the synovial tissue. It lives in the matrix of your body. It doesn't live in the blood. So we keep thinking, a blood test will work. There are other companies that are not covered by insurance. One's called Igenex, and the other is Armin Labs in Europe, and they do more of a PCR test. They do a test with blood and urine, and it's more accurate in a lot of ways. But I would say everyone goes for the Western blot first, because if you get a positive in that, that means the Lyme was active. They found it. Okay. There. I won't go through all the reasons for this. Different times in the cycle of your body and the life of the bite or the life of Lyme that you could get a positive or a negative depending on the timing of it when you did the test. Okay. So that's why the muscle testing, people are drawn to the workshops that we have taught and the protocols we teach, because these are doctors that come that have been treating this for a long time, but they want more tools in their pocket because they want to heal that patient. Well, let's like get that one in. They're curious. What's going on here? Why are more people having Lyme symptoms? Why does it seem to be more active? That's what our group looks at. Deep look beyond it. And that has to do with clearing the body.
So is there a specific name? This is one of the questions on the chat from the listener. Yes. Is there a specific name for the muscle testing that a person needs to get?
Well, Dr. Klinghardt teaches something called autonomic response testing. That is what has been taught. Now at Discovery Health, we're not teaching that. You know, he's still teaching that in Europe, but we're teaching all different types. We're teaching things that are takeoff on that. Okay. There are many other deeper forms of assessments that our doctors that did learn all of that are doing now. We call it the more advanced work. So anyone that, people that are coming now have already taken a form of muscle testing that maybe they don't only test on one level. I mentioned something called 5 levels or whatever, like spirit, mind, body, the full body. Okay. And in the medical world, we can focus on the physical. Okay. Even with detox, you're thinking about sauna, you're thinking about sweating the skin. But we know where detox really happens is when you get yourself into a position of being free, spiritually, mentally, emotionally, while you're sitting in the sauna, for an example. The same thing. So we teach in the muscle testing thing, the emotional part is number one, emotional, spiritual, finding if there's a block there. And in America, we have a lot of blocks to those things. We're stressed. So stress makes the body not want to sweat. Stress makes the body not able to detox totally. And that's something that needs to be worked on a more regular basis individually with each person. You can't tell them what to do, but you can enlighten them to think about that, especially with all of us being in now.
Yes.
So when I sit in the sauna, I try to think of, okay, this is my time. Mm-hmm. There's no don't take the cell phone in, you take your time and you just want to just have a little gratitude, be thankful for some things. That changes everything and completely unwinds your body. And even be thankful for the one that, just did something bad to you, that you didn't hurt, or whatever that thing was, the hurt that you either gave to someone, forgive, all of that untangles you. And then it all releases, goes together. Mm-hmm. And that's what we teach in our classes, for the doctors to figure it out, to remind a patient on the table, you know what? I think you've got this because there must be something related to da-da-da. And they're spot on like that.
Oh my gosh, that's awesome. And so this is the work you're doing now at Discovery Health.
Yes. That's fantastic. It's called unmasking autonomic dysfunction. And when we do that, people come in with chronic pain. I personally experience that because I have pain sometimes from running these workshops. I come in stressed out. I mean, you know that. You run a business and the stresses of business. And I'll be with the doctor and I say, listen, to one of my doctor friends in the Philadelphia area who's really good at this. I say, I'm feeling stressed. What's it? And he puts it on the table. He goes, Debbie, when I say this word perfection, what does that mean? My back is hurting. I said, I was trying to get that whole thing perfect. And as soon as I do that, he just touches me a couple places. So the pain is gone, totally gone that I've had like 2 weeks. Severe. Wow. So it doesn't mean all pain goes away. It's just that's one example of using a muscle test to quickly, boom, boom, boom. Is it structural? Did you injure it? Is it just some kind of emotion that's stuck in that spot? Okay. And those are the things that all of us that know this, when we use the tool of a sauna or other things like that, we incorporate that into it all. So we kind of think in those realms.
Right.
Mm-hmm.
Right. I think it's a good place. Like I always encourage people when,
Mm-hmm.
when they do take the time and invest in themselves and spend, 30 to 40 minutes inside a Sunlighten sauna, is use that time, also you can do multiple things while you're in here, right? And it's a great time to meditate, or it's a great time to just reflect, or get your head in that kind of just positive state and just purge all of that mind chatter and any type of self-doubt or any type of worry. And so that when you come out, because you come out naturally with your body, you come out feeling refreshed and ready to conquer that next thing. But you also want your mind to have that same release and that same purging. So I'm sure back when you were doing this with your daughter, I'm sure that I would think part of the reasons that you both were able to heal is that investment in detoxing your brain too, right? Detoxing your thought process.
Well, she has her own story with that probably, and she's probably, I think she just hit the other side on Mother's Day. She was able to say something beautiful to me like 2 weekends ago, both of my kids, who used to always complain, Mom, I've had enough of this health stuff. I've had enough. I felt like I was like forcing it down them, and all the pills I gave her that ended up in a pile in a swim bag as mush. I'm talking hundreds of dollars worth in a pile of mud, the swim bag, you know. So, and then she said to me, Mom, after all of that, I finally realized I know what it's like to be sick. I know what it's like to be healthy. And I'm living that healthy lifestyle now. Thank you for putting up with us and getting us through it and teaching us when it wasn't popular, when it was a secret. We didn't tell anyone she had Lyme disease because she wouldn't be able to be a swimmer. She'd be off the team. Okay, you don't do that. She held it secret. So I think holding it secret was hard for her,
Yeah,
and she didn't heal that way. She didn't heal that way.
Yeah.
Yeah, she had a lot of stress on her. I won't go into her whole story, but she has one now, and she's able to help a lot of people through that. And yoga helped her. When she went off to college, she found yoga, and she never told the college coach either that she had it. And she had trouble. She was not just hospitalized a few times with some, issues, some female issues related to Lyme, okay, and things like this that came up over time. And I wasn't there to help her. I wasn't there to keep her healthy. And I bought her a Vitamix years ago when they first came out, and she still has it, and that saved her life. She says. She told me that she and my son had it through the military, and they're the only ones doing it, and they still live that. So it gave me joy that they're actually choosing that now. But as you know, Connie, if you have children and you're in the middle of the sports thing, you can't tell your children anything. They'll listen if they're polite and respectful. Hopefully they are. They're not always. But they get to a point they're pulling away from mom. They want to choose their thing, and they think whatever we tell them is a little crazy. So it's a learning experience when to pull back on that. I coach a lot of parents. Hey, they call me. My son's in college. There's more kids have this than we know now than ever did. And their children are being pulled out of college. They can't cope, can't be there with this. It's pretty much Lyme. And I said, you got to let them choose. Have your son call me, or have him call my daughter. You've taken them so far. Or if it's your sister or it's your grandchild, I'm getting all these, my grandchild. I said, well, if your daughter-in-law is interested, have her call me. Family relationships and the stress of keeping them together and the love and respect matters more than shoving, a supplement or a protocol that's so out of the box on someone. And what I'm talking about is out of the box probably for most people listening to this, with the spirit, mind, body. People are drawn to some of this, but to even capture and go there is not always easy.
Mm-hmm. Yeah, no,
I know that.
I agree. It made me think of, when you're talking about the spirit, mind, body, it made me think of protocols of just that, you have suggestions for people of, you're found out you have this, and kind of we're running a little bit out of time, but I really want to help as many people as possible who, are maybe concerned. And so it's one thing to be like, okay, spiritually or mentally, okay, I've got this, but, we talked about the Sunlighten, of course, that this is a great, amazing tool to detox. Anything else that you would recommend, you find that you have, or you think you may, and things, aside from the antibiotics, that you can start to proactively do?
Well, number one, I would say do educate yourself
That's awesome.
on it. There are many good resources out there. There are very different opinions still on what to do. And you have to go with your gut feeling. If you are a person that only just goes with 100% science, medical, and someone that's an MD, you're going to go a certain route. You're probably going to do the antibiotic route. That's just what you're going to get. And don't even try to talk to these people about anything else. You got to make your decision on where you're going to try. And then stick it with it for 3 months. Stick with your gut thing for 3 months, on your treatment. If it's not working, you're still drawn another way, then switch. But stick with that for 3. Don't be jumping doctors. Everyone calls me, I'm seeing this one. And I said, well, you're not getting better because nothing works like that. Natural things take minimum 3 months to start seeing your body to balance for the new
That's so important. I'm so glad you said that, because people, everybody wants like the express, right?
Yes.
Like they're like, okay, I'm going to my sauna and tomorrow I'm going to be healed, and,
yes.
Especially if they have like mental fog, that comes, that's one of the issues with Lyme, or just pain, they just want it all to be gone, instantly. So I love your comment about being
stick with something. And and it is good to have a regime. I know when my health doesn't feel as great with the autoimmune stuff I deal with, it's because I'm traveling. I'm running, I'm doing things in the health world, running things for all the other people, and then I let myself go. So I've actually been so much better being home during all of this time, using everything. I almost sat in the sauna just for fun today to do this with you. I think you're in yours, just as a little funny thing, because I'm enjoying it more and I have things under control. And I even lost 15 pounds naturally. I pick up weight. It's one of my things. I'm traveling, not from eating bad. So I'm back to my normal just self. I feel really great, hydrating. So the biggest thing is hydrate. The other thing you can do, I say eat correctly. That's another whole subject we could talk about another time, but it does matter. It does matter because you're not going to detox if you're putting wrong things in your body that actually block your body from functioning correctly. It'll block the detox. You could be building up a storage of candida everywhere, and then it blocks other stuff from coming out. Your regular toxins won't come out. And that's eating white. And, there really isn't one diet for everyone. We've had all these nutritionists come in over 10 years. I've listened to them all, and the jury's out on that, but there really isn't one. And you have to know your body, know what works for you. But in general, we start people off with a gluten-free, no white. We just say colors, no white, which is sugar, flour, dairy. We stay off of that to start with, and you can start adding a few things in here and there if you need be. Most people do well on a Mediterranean type diet that have Lyme. Okay, I'll just say it in general, but not everyone. The people that do worse are the people that are vegetarians. And for some reason, young Lyme patients, they can't eat meat. They just don't feel like they can eat meat at all. And they go through a stage of being a vegan, vegetarian. It may not even be because of animal reasons. It's just that they just don't want to eat meat. You need the meat because you end up losing a lot of connective tissue with Lyme disease, and you need a certain amount. It's a small little amount, which is kind of like a Mediterranean diet. You have the right oils, mostly good vegetables, and a little meat at every meal. You're pretty good, as a general guideline. Then your body will normalize. As I just said, you kind of get normalized when you feel good. Your mind's so spot on without the sugar, and the candida build up. And when you get in the sauna, you just feel like even more awesome when you're eating right.
Yeah,
that would be a guide for the Lyme, because then Lyme it usually goes into hiding. Okay, so I say, I'm Lyme free. My daughter's Lyme free right now, and who knows if it's still like lurking, but it doesn't come up in a muscle test. It's come in any test. The symptoms aren't there. We have other things to work on, but the right diet would be really, really good. And then having, you don't want to be thinking about a lot of supplements, but there are a few supplements that today we need because with toxicity, it's not just what's in our body, it's what's on the outside that comes in through our lung. We're finding the lung and what we're breathing is creating more of an impact than ever. I'm not even going to talk about why we're all stuck in. I'm not going to mention those words, but it's a lot of things are what we're breathing in the lung. And it's nanoparticles usually of aluminum, glyphosate, fluoride that we drink. It's things we're breathing in. It's not just one item. So if you can keep things clear, it is really, really crucial in today's age where the environment is really out of control. And if you look outside and you're so concerned about the woods and the forest, and we should be, in the beautiful air and everything, but think about that's what our body's like. If the ecosystem outside is bad, it's a reflection of what's really going on inside. So you need to think about all of that and do what you can do for both environments. So that helps for Lyme disease. Okay, that's a positive thing.
That's very helpful. I have another question here before we wrap up. I know I really appreciate your time. So sure. I'm very respectful. I don't want to keep you, but your information is just so helpful. So this question is Rocky Mountain fever from a tick the same as Lyme?
No. And interesting, I didn't go through like the whole deal with my daughter. I am putting it up, and I did put it up on ended up being a 14-page blog, and it wasn't even everything. She had Rocky Mountain spotted fever. So the big tick she had was from the Western tick. And it was not just Lyme when we had her tested, it was Rocky Mountain spotted fever. The doctors here never saw anyone with it. And they're shocked that she was doing as well as she did with it. And it's different, and it's pretty easy to treat if you get it right away. No one got it, even out there on the West Coast when I told them she had a big tick. So it's different and different symptoms, but what's actually a lot of symptoms overlap. That's another whole topic. I'm going to have a list of symptoms here. What you may think, if I read the whole list of symptoms to you, which I could quickly, you're going to say, oh, I have it. I have the symptoms. Right. Because it's a great imitator. It mimics many things. And people with MS, ALS, Parkinson's, autism, Alzheimer's, they all have some of those symptoms too. And you're going to think, oh, I'm getting one of those diseases. Don't think that way. Okay. So sometimes I say get educated, but sometimes less is more because we're in the era of too much information. And it's like us listening to the news every night. Every day there's another fear or some new information. Okay. And it's not all, as we know, it's not always accurate. Okay. So you learn a little bit. And the biggest lesson I learned from this online woman with the famous German doctor was, she said she called me LP because my nickname was Lyme Parfait when I first went on, because my daughter painted her room lime the day we found out she had Lyme disease. I don't know why, but thought it was catchy. And she told me I had to change my name. She says, notice I don't call you Lyme Parfait, I call you LP. And I said, why is that? Wow. She goes, I don't say that word Lyme, it sets it in. So I quickly changed my name to Light Parfait, She goes, oh, the famous German doctor works with Light. I had enough of him, it's so funny. But there's something to that, and it stuck with me. So if I can leave something with you all. Yeah. Don't say my Lyme. Everyone calls me, my Lyme is bothering me. Well, it sure is yours. I don't want it, it won't leave you. And for mothers out there, there's something that is called an invisible umbilical cord. After you give birth, it's cut, it's never gone. And we know that emotionally because, we're always going to be the mom, even when they're older. But more than that, when we have an emotional attachment to something, there's an emotional winding and twisting of our children. So the day that I was able to change my name on that forum to Light Parfait, that's when everything unwound for both of my daughter and me. Okay. Wow. So think about that. It's not your disease. You're not a disease. It's just something you're dealing with today.
Yeah, that's just brilliant and powerful. And I mean, that in itself is such a great piece of wisdom that I hope everybody takes with them. Words matter, thoughts matter. It all matters. And I appreciate you referencing that. I do want, before we close, when you mentioned Dr. K, I want to
Yes.
I feel that compelled, because I worked with him for so many years. One of the things that was really important to him, when working with Sunlighten, was always making sure that we had the lowest EMF possible.
Yes.
Right? You remember, so that was always, I remember all those conversations.
That's a conversation daily with patients. Yes.
Yeah. So I just want to make sure anybody who is listening, because I always think about him way back before EMF really anybody was talking about it. That was something with Dr. Klinghardt that was really important to him. And that's something that was really important to Sunlighten is, we are a wellness company. We're in this world to lead this world a healthier place as a result of what we do every day and to make a difference. And we take it very seriously. Everything we put together in the sauna, as far as the electromagnetic field, the fibers we use to protect the heaters, the wood we use, the lack of glues, all the materials. So I just kind of want to honor that experience with him and honor him with just letting everybody know that it was really important to him. It's really important to us. You can feel very safe and secure that, with Sunlighten, we do protect. We always say it's virtually non-existent EMF, in our signature and solo saunas. So
if I could add a little to that in a positive way, what he has said and what we experience is that sometimes having a small amount of EMF, when you're doing a positive thing, the positive thing outweighs that small amount. And he's speaking related to saunas, foot baths. Some of the tools, people say, oh, but it has a certain amount of frequency, because they're so paralyzed by the fear of EMF. That's another one. As soon as he speaks, you won't believe how many, wherever he speaks for a podcast, I get so many calls. They're in fear. What can I buy? What can I buy? I said, no, don't buy anything. You probably don't need any of it, But there's a fear with the EMF now. The idea is educate yourself, but be smart. It isn't leaving. So you figure, what do you need to use and do it smartly? And there's nothing wrong with the sauna. It is good to get a low EMF one, but you don't have to have a no EMF sauna or foot bath or whatever you're using in the house.
Right. Absolutely. Yeah. Well, most importantly, get the product that's going to heal you, right? And get the product that's going to take that those toxins out of your body as efficiently and effectively as possible. So
if anybody else would like to know any more, I have a whole little PDF on basics of Lyme disease and our thoughts on it. And I'd be willing to give that to anyone if they emailed me, because I never got into all of that, but we can do that even another time if you wanted to. But I have a PDF just with all the basics, how our group thinks on Lyme disease, and also my full story if you're interested. But again, thank you, Connie, for giving me the chance to speak. And thank you, anyone who's out there listening, in media world.
Well, do you want to share your email so that people can?
Sure.
Yeah, and we can put it in the notes. But anybody who's listening can can email you directly, because you've just been amazing. And if I was listening and I had any questions, I would want to contact you.
Yeah, and I'm also willing to give out names of doctors in your area. I do that. But it's Discovery Health Solutions has been the parent company I run for 10 years. And you can get me at either info@Discovery Health Solutions, or my direct email is Debbie, Debbie, middle initial A like Apple, last name Floyd, as you see on the screen, FLOYD @gmail.com, DebbieFloyd@gmail.com. The website that we have for Discovery Health is just a holding page right now, and it does probably have a PDF of some of the doctors. We train probably 1,000 a year, and I only put up the ones who I considered certified, meaning they do it all. They know it all. But if you need someone, I just give out names because I was there, with you. I don't charge for that. I don't want to spend a lot of time coaching people. I do that occasionally. If you catch me and it's a good moment, as some of you may know, I have given you my heart. And I just want you all to have a healing experience, and to know that it's a journey, and to know at the end of the journey, we're not going to be here forever. So do what you can now. Love your neighbor. And I want to be the last part of my life on this planet, a servant of people. So again, feel free to reach out to me. And if you want to learn, we do teach some patients. We teach mostly health coaches and practitioners to advanced muscle testing techniques and emotional clearing work. Love to have you join us.
I love the emotional clearing. That was just so powerful. So I really appreciate you sharing the umbilical cord and just that piece is such a great visual piece for people to think, especially right now when they're inside and they're trying to create these new healthy habits that will take them forward in our new normal. And that's a great thing to start today. I just really encourage everyone to start healthy habits today that will take you forward and to change your lifestyle to be, stronger and more powerful and more in control when we come out, so that you can be as healthy in this environment. Because like you said, it's not going away. I mean, you're not going to all of a sudden go out and it's like, okay, everything's, gone. So what can you do at your home to be as healthy as possible? So, in honor of this special Enlighten with Sunlighten series, where we are with our special guest, Debbie Floyd, we are offering a Sunlighten special. Contact us. Just ask for the Debbie Floyd special, and we will honor that through Memorial Day weekend all the way through the end of the month for Lyme Disease Awareness Month. It'll end May 31st. Whatever we can do to help, you, the world, and Lyme Foundations and awareness is part of our mission. So thank you again, Debbie. It's so great to see your beautiful face, and thanks for most importantly sharing your story. A big shout out to your daughter for just everything that just going through.
And she's willing to help anyone young. She's 29. Reach out. She actually runs the hive.health, and she puts up her protocols. And anyway,
that's fantastic.
Her style, the young style. Yeah.
Well, I'm sure she's very proud of you and what a great team that the two of you made. So thank you so much for sharing, and to the audience, thank you for spending this time with us on Sunlighten. And on that note, if you have other topics that you would like to hear us broadcast on Enlighten with Sunlighten, please let us know. You can email me directly or at czack@sunlighten.com, or just contact Sunlighten on Facebook or on our tribe page, however you want to communicate with us. Thank you all so much. Thanks, Debbie. It's been great. Really enjoyed it.
Okay. Have a good weekend. Bye, everybody. Thank you for joining.